Hello and welcome to the public health series of this channel, and I hope that you find this useful. So over the next few weeks, I'll be going through different aspects of public health. I will start this series by doing a basic definition of what public health is. So you might have come across various definitions of public health. There are simplistic definitions of public health, and there are very complex definitions that are made up of many words, many phrases. But not all of these definitions are actually right. But to start with, let's just do a simplistic definition of public health. Public health in a simplified way would be defined as a discipline that seeks to address health at a population level. So medical practitioners generally would address health at individual level. They're actually more focused on the biological basis of health, whereas public health is more interested in the health systems and how health can be delivered to a larger number of people. A more complex definition of public health by the World Health Organization is that public health is an art and science that seeks to prevent disease, prolong life, promote health, and this is achieved through a collective effort of the society or an organized effort of the society. In a nutshell, this definition shows that there are three pillars to public health, which includes disease prevention, health promotion, and prolonging life. And saying that public health is an art and science actually may sound bizarre to someone who might actually imagine that most health fields are actually within the science domain. But as a matter of fact, public health involves a lot of art. For example, a lot of the health promotion that is being done actually involves a lot of creative art. So creative art actually goes a long way in health promotion. In addition to this, visual art as well can promote different aspects of health. Visual art has been used extensively in mental health, service provision, even mental health disease prevention. So there is a lot of art involved in public health in a nutshell, and I've just highlighted a few. So what do public health practitioners do? It's probably best to discuss this by first highlighting the four core areas of public health. The first core area of public health is epidemiology and biostatistics, and I'll get into more details. As a matter of fact, we would cover the different core areas in separate videos. Another core area of public health is health protection. Another one is health promotion. And the final one is health policy. Now, some school of thought actually consider environmental health as a separate core area. But oftentimes, it's not uncommon to find environmental health being considered as a subdomain of health protection, wherein health protection would include communicable disease control, environmental public health, emergency preparedness, resilience, and response. So these are the four core areas of public health. And if you would break down public health into a pie chart, you would have those four equal parts. And that takes us to the next question. What do public health practitioners do? Public health practitioners in general could find themselves in working on a very broad range of subjects. For example, you could find yourself formulating public health policy, contributing or developing health promotion strategy. You could find yourself working on disease surveillance. You could end up working on research. You could become a researcher. You could end up working on disease surveillance. You could end up with bilateral organizations. You could work within local health ministries, and you could even work in a university or you could end up working in the academia. So the sky is the limit for public health professionals, really. And that leads us to the next question. Why should people consider, or why should I consider public health as a health as a health professional? First and foremost, public health could actually be that sea change that you're seeking for in your profession. Secondly, public health could actually lead to you having a broader knowledge of how the health system works. And this could actually enhance your existing health practice. In addition to this, it could actually be an avenue for you to contribute even much more extensively to the health profession. Because public health actually gives you the lever to be able to, or the leverage to be able to contribute health to a very large number of people, because you're addressing health at the population level. And you might end up enjoying public health and having that as a complementary aspect to your existing practice, if you were already within the health domain. And if you're coming from a non-health field, as I've highlighted earlier, public health is both art and science. You might actually have a very different angle or a very unique contribution to public health, and you might actually be enhancing public health as a profession as well. So it's quite interesting. And if you are considering opting for public health, probably taking a MPH program, I would definitely encourage this. It can be very rewarding and very fulfilling. And thanks for watching. Please kindly subscribe to this channel for more interesting videos on public health and productivity for health professionals in general. Thank you.